we are still faced with challenges as women and children. We do have summits after summits, workshops after workshops, but seemingly it doesn't stop this thing of abuse. But we cannot throw away a towel. We must try our level best that we can and request the stakeholders and the communities to assist us in this sketch. I just wish to make that plea to all of us. We are really faced with challenges, especially in this month. Anyway, God is also going to assist us as women, because there's a lot of patriarchy in our society, which needs to start from us, not to do the pull head down syndrome from our side. And let's support other women, and let's make sure that we look after our children, because they are vulnerable in these days. I wish to welcome everyone in this meeting. Hope that this meeting will be successful, because we've been longing to hear the information and the report from this entity or this group. So can Lindy flight the agenda for us? Everybody is welcomed in the meeting. Feel free to deliberate whatever. Lindy.
Morning, Chair. Here is the agenda. Chairperson.
Recording in progress.
Lindy? Lindy, thank you very much.
Chairperson, I've flighted the agenda.
Yes, I can see it. Just move it up. Yes, the next item on our agenda, I'm sorry, in fact, I had a glitch. The next item is introduction, and you, by ourselves and officials, and also you have to tell us whether we correct or not. Thank you. Over to you, Lady.
Thank you very much, Chairperson. Good morning to you and our members, departmental officials, and any stakeholders in our midst. Chair, today is the 9th of November 2022. There's an officially National Assembly meeting to consider the annual report of the CDA. I'm here to confirm the members of Parliament serving in this committee. We have you, Chair, as our Chairperson, Member Mbana. We have Member Abrahams. We have Member Masango. We have Member Stock. We have Member Pilangulu. We have Member Mfikwe. We have Member Opperman. We have Member Aris. If I've omitted to mention any member, can indicate so. Those are the members I've managed to capture while I was busy before I make the announcement. Chair, I wish to confirm that we are a quorum. We can proceed officially with this meeting and take official decisions. Thank you very much, Chair. Over to you.
Thank you very much, Lindy. Thanks ever so much for those that managed to attend the meeting. Then from the side of the department and from CDA, can we give over to acting DG?
No, thanks very much, Honorable Chair and honorable members. A very good morning to you, and very good morning to everybody in the meeting. Thank you. From the department side, you're duly represented. Both myself and the team from the department are in the meeting, as well as the representatives from the Central Drug Authority are in the meeting. I must just tender an apology for the minister. She is out on official duty at the moment, out of town. I've not seen the DM here as well, but we are duly represented in this meeting, Honorable Chair. Thank you very much.
Thank you very much, Linton. But you haven't made mention of the CDA members that are present.
Thanks very much, Chair. I know that there is an apology for the chairperson of the CDA, Ms. Mayatula Khoza. She's not able to join the meeting, and she's tendered an apology due to a commitment that she cannot get out of, but she is duly represented by the Vice Chair, the Deputy Chairperson, Ms. Nongebo Dlamini, who is here, and she will indicate, Chair, through you, the members that have also joined from the CDA side. Thank you very much, Honorable Chair.
Okay, thank you very much. We'll give them the opportunity to do that. I just wanted to know whether are they in or not. Thank you, Linton. Lindy, let's give the CDA will introduce themselves during their time of presentation. Can we get the apologies from your side, Lindy, the honorable members, and also from LinkedIn, the apologies? I've noted one of the one that of Ms. Nandi Mayatula.
Okay, Chair. Thank you very much, Chair. I have an apology, the internal apologies. I've received an apology from member Sukars, who is unable to attend today's meeting due to prior engagement. Also, there's an apology from member Fana Merve, who's away in Ivory Coast attending a conference. Chair, I wish to concur or to confirm an official apology submitted by the Office of the Minister that he is in Tanzania to a conference on population and development. Also, there was an official apology submitted yesterday from the Office of the Chairperson of CDA, Ms. Nandi Mayatula Khoza, also confirming that she won't be with us, as explained, as alluded by acting DG Chair, that, and he confirmed that the person that will spearhead the process is the Deputy Chairperson, Ms. Dlamini. So I've got only those apologies, Chair. Also to inform the committee that Ms. Kanye, our content advisor, is not with us today. He has a bereavement. She's attending a funeral. Thank you very much, Chair.
Okay, thank you, Lindy. Thank you for that. From LinkedIn, if there is any apology, but he has already told us about the apologies. Is the Deputy Minister present with us?
Chair, we are just following up with the DM's office. I know she was supposed to be in attendance this morning. We are just following up, and we will revert. Apologies for that.
Okay, thank you, Linton. Thank you. So far, so good. There are no apologies. I take that the apologies have been accepted as they come. Let's continue, Lindy. According to our agenda, there is an adoption of the agenda. If we don't have the DM and we don't have the minister, there is no need for a political briefing or political overview. We take for granted that they are with us and we'll get the political overview once we discuss all of this. LinkedIn, can you then give over to the deputy chairperson? That is, you said it's Nomcebo Dlamini. Can you give over to her so that she can be able to introduce the team?
Okay, Chair. No, thank you very much. Just as I hand over, I just wanted to indicate just 2 or 3 things through you, Chair. Firstly, just to indicate that, of course, as a department, we continue to work with the CDA in terms of providing the necessary secretariat support and the necessary support that we generally provide, as well as are also accountable to the CDA on a number of areas that relate to our work insofar as achieving the National Drug Master Plan. Of course, we are currently implementing the 2019 to 2024 National Drug Master Plan, and we are halfway through that. We're at a point where we probably need to do a review now. And the presentation, of course, focuses on the annual report of 21-22. Chair, you will note that the presentation would start with really giving you some feedback on the previous discussions that were had with the portfolio committee on the CDA, on the National Drug Master Plan, both in terms of, I think at the time it may have been the inception of the actual plan. We have 25 members, as you would be aware. 11 are independent members appointed by this very committee, and 16 members from government. And of course, by virtue of the CDA reporting to the minister, from a governance perspective, we have an oversight sort of meetings that we have on a regular basis, which is statutory, through which we engage the CDA. So on that score, Chair, I then like to, through you, as per your guidance, hand over to our deputy chairperson in the absence of the chair of the CDA at this point in time. I think you're going to introduce the members as well, please. Thank you.
Thank you very much, ADG. Good morning, Honorable Chairperson and honorable members of the Portfolio Committee. I am sitting here in the room that I'm in at the World Health Organization offices, where we are actually working on a biannual summit, our plans around that with different members of our stakeholders that appear on the National Drug Master Plan, the likes of SANAC, WHO, SAMRC, and the Alcoholics Anonymous from Cape Town. Quite a number of people that are here at the WHO offices. And just to state, honorable members, that this was an engagement that was planned a while back. So it was a bit difficult for us to just change it and cancel it in honor of this meeting, which we consider to be very, very important. Next to me, I have in the room only one of the members of the CDA, the executive committee member, who is governance committee chairperson, Ms. Nomathemba Kela. Online, I have Mayor Mahlohonolo Mabue, who is appearing there in the nice Duke. She's based in the Free State, and that's where she is right now. And she is the chairperson of the Finance, Social and Ethics Committee. So these are the team members that I have who are members of EXCO. As has been mentioned, the chairperson is not available today to be with us here, but she does send her highest regards, and also just an acknowledgement of how important this engagement that we are having with the Portfolio Committee is to the CDA, and we truly appreciate the opportunity. After you appointed us as the 4th CDA, this is our first engagement, and it is quite an exciting time for us to be able to relate with you in this manner, as well as to report on what we have done in the time that we have been in office since you placed your confidence in us. And we hope that we are working hard to make sure that the confidence that you have placed in us has not been misplaced, as well as the country, actually, not necessarily just the portfolio committee, the confidence that the country has in all the elected officials, as well as all persons that are in any position of responsibility and leadership. So with that, I would like to say thank you very much. And may I be able to allow to share? I don't know if I've been given the sharing powers.
Just before that, thank you very much, Deputy Chairperson, in terms of introducing your team. Just before that, there's an omission that I did in terms of adopting the agenda as proposed. Can I first give over to the members to adopt the agenda for formality reasons? Honorable members, can we adopt?
Chairperson.
Yes.
Chairperson, good morning. Honorable Abrams, I move for the adoption of the agenda as presented.
Thank you, Honorable Abrams. And then any seconder?
Good morning, Chairperson.
Honorable Stokes.
Good morning. Thank you very much, Chairperson. Good morning to my colleagues, the departmental officials, as well as the CDA board members. I would like to second the proposal for the adoption of the agenda. Thank you very much, Chair. Thanks.
Thank you very much, Honorable Stock, for seconding the agenda as proposed. Then let's go back to Ms. Nomcebo Dlamini, the Deputy Chairperson of the CDA, to continue with the presentation. Over to you.
Have I been allowed to share?
Yes.
Yes.
Are you ND next CDA Deputy Chairperson? I gave you.
Yes.
You can share.
I trust you can see my screen.
Yes.
Okay, thank you very much.
Continue, carry on. Thanks.
Honorable members, this is a synopsis of the report that was presented to the Portfolio Committee on the 30th of September, which is the work of the CDA from April 2021 to March 2022. What we are going to do, which we felt was quite necessary since we are the fourth CDA, and there was a third CDA that had work that was presented to the Portfolio Committee that was sitting at their time in office. So we would like to recap on the last Portfolio Committee recommendations and progress on that, to brief the Portfolio Committee on the annual performance, to reflect on the current challenges in the country relating to substance use and substance use disorders. The recap, this is what is going to be the flow of our presentation, which will be the recap, introduction, CDA mandate, powers and duties, the 2019-24 strategic intent, summary of 2021 annual report, which will be the situational analysis and DMP implementation analysis, evaluation and recommendations, as well as current challenges, way forward and conclusion. The recap on the last Portfolio Committee recommendations and progress, which we felt was quite important for us to just reflect on, is basically the first issue that came out from the minutes was the issue of the Free State Treatment Center. And we would like to just report that the treatment center was launched by the Minister of Social Development on the 27th of April 2021. And the CDA has had an opportunity to visit the center, and that happened in October 2021, which was the time when we were working on visiting all treatment centers, public treatment centers in the country. The repositioning of the CDA, the current status remains, but DSD is developing a policy towards the review of Act 70 of 2008, and CDA has provided policy advice on this matter. Increase in number of social workers dealing with substance use disorders. DSD is still to advise us on that, and we are engaging them, and they are quite cooperative in giving us the information. It's just that they are still working on bringing the numbers together. The CDA is currently performing an audit of all the services, and we have started with treatment centers, as mentioned before, with the treatment center visits that happened in October 2021. But the current reality is that the services are inadequate. And that is something that I think there has been discussed even with the Portfolio Committee and DSD. And that is what still remains as a reality. The data clearing warehouse system on substance use disorders. So there is a data clearing warehouse that exists at DSD, and we visited it as a sport CDA. The CDA recommended revamping of the clearing house so it functions well and allows for easy access by members of the public. This will be done through interns who will be engaged in collaboration with NYDA. We are working with NYDA to bring in interns that will assist us with some of the functions of the CDA. CDA is engaging SANAC as well for benchmarking purposes. And I did mention in my introduction that we are working quite closely with SANAC, and SANAC is currently with us working on planning for the biennial summit. And the CEO of SANAC is there, and they are really, really quite helpful in engaging with the CDA. Capacitation of PSAPs and LVACs to enable them to function optimally. The CDA has engaged SALVA towards encouraging mayors to establish and support LDACs. This we did through going to all the conferences after the elections last year, the conferences of each province. We end the induction. We started with the conferences where all the mayors were there and all the councillors were there, and then we went further to engage at inductions of all the provincial councillors in all the provinces. CDA will be engaging MSCs to encourage better support of PSAPs. This is an issue that is quite an important one for the CDA, because we realize that without the support and maybe facilitating of capacitation of the PSAPs, it is a bit difficult for them to function. We are engaging very closely with the PSAPs. They are part of even the engagement that we have today here, and they have indicated to us, as was reflected to the last portfolio committee, that they have serious challenges at provincial level. The CDA has identified the provinces that do not have structures aligned to the portfolio of the CDA, and we are giving attention to this matter. The departmental representation, participation, and accountability. The CDA engaged DGs of departments and increased participation of departments from 18 to 16. When we came into office, honorable members, we found that there was a challenge with departments not reporting and not engaging well with the work of the CDA. But we are glad to be able to report to you that since we came into office, one of the things that we did is engage intensely with the DGs. And now we've got 16 departments that are actively involved in the work of the CDA. The departments that are still without representatives, unfortunately, are transport, economic development, agricultural reform, and rural development, as well as the National Treasury. We are working still and engaging, and we are hoping that we are going to be able to give you a different report when we present you with the report next year. The CDA rules are still to be promulgated. They state that proxies who are often junior officials must be appointed formally to remedy the challenge of seniority. This is another matter that was brought forward by the Portfolio Committee when the last CDA came to report to you. And we have placed it in the rules that proxies who are often junior officials who come to our meetings, they must be appointed formally, and we are hoping that that will remedy the challenge of seniority, because if they're not senior enough, they're then not able to report back to their departments and ensure that whatever decisions are made or resolutions are made in the CDA, they then find some kind of action in the department. Alignment of the NDMP to government's medium-term strategic framework. The NDMP 2019-2024 is aligned now to the NTSF. The CDA has further engaged the TPME towards further alignment of its APP for 2023-24 in the following years. The CDA has an APP that we have developed, and we are aware that we might not necessarily be required to submit this APP to Parliament or to to the Department of Monitoring and Evaluation. But we felt it was quite important because if we are not able to look at our own selves and be able to measure our own work, then how are we able to say that we are actually achieving that which we have set ourselves as goals, even the goals of the National Drug Master Plan? So we have engaged at the PME, and they are going to be receiving our APP and looking at it, and they are also advising us and working very, very closely with us in this regard. I will go into the current report that we have presented to you. On the 1st of April, the current 4th CDA came into office to serve a 5-year period until 2026. This report is the third one that is reflecting on the work performed by the 4th CDA. The last annual report noted that in reviewing the NDMP, measures were taken to incorporate the resolutions of the UN General Assembly Special Session in 2016, wherein countries were encouraged to treat substance use disorders like any chronic disease. So basically, that is what our focus is on as we are doing all the work that pertains to the National Drug Master Plan. The report that we are presenting to you covers 2021 April, the 1st of April 2021 to the 31st of March 2022, and measures achievements, identifies challenges, and makes recommendations. The report is drawn from reports received from various stakeholders, including departments, entities, and stakeholders designated in terms of the Act, which is Act 70, and others with whom the CDA has forged partnerships. The CDA mandate is that it is a statutory body established in terms of Section 53 of the Act of Act 70 of 2008. It has 27 members currently, and they have been appointed by the Minister of Social Development for a period of 5 years. 11 of these are independent members of society, which were recommended by the Portfolio Committee, whilst the other 16 are representatives of national government departments. The CDA reports to the Minister of Social Development and to Parliament. As per Act 70, the powers and duties are amongst of the CDA are amongst others to oversee and monitor the implementation of the National Drug Master Plan, facilitate and encourage the coordination of strategic projects, encourage government departments and private institutions to compile plans to address substance abuse in line with the goals of the NDMP, facilitate the initiation and promotion of measures to combat the abuse of substances, advise government on policies and programs in the field of substance abuse and drug trafficking. As mentioned, these are not all the powers and duties, honorable members, but these are the ones that we want to just highlight here. One of the powers and duties is also to engage in matters of HIV and gender-based violence and all that, which is why we have as our stakeholders, which we are engaging with, the likes of SAMAC, and we have also engaged at length with the Department of Women and trying to work on how to deal with the issues of gender-based violence in the country. The vision of the NDMP is a South Africa free of substance abuse, and then the mission is to embrace a balanced, integrated, and evidence-based approach to domestic drug use, misuse, and abuse. Invest in building safe communities through appropriate drug prevention and impact minimization strategies. Control the demand and supply of substances of abuse and misuse, effectively control substances for therapeutic use and the emergence of new psychoactive substances. The National Drug Master Plan has a strategic approach, and that is based on these 5 principles, which are inclusivity and participatory principles, rights-based, evidence-based, multi-sectoral and multilateral, people-centered. The target population is youth in and out of school, children, women, including pregnant women, persons with disabilities, occupational groups at risk, key populations, which includes persons in prisons, and LGBTQI population. In terms of the goals, it has the 7 goals: demand reduction through prevention and treatment of drug use, misuse, and abuse; supply reduction through effective law enforcement and responding to drug-related crimes; control of drugs intended for therapeutic use; identification and control of new psychoactive substances; governance, leadership, and accountability, which is where we feature the most as the CDA, and which is another reason why we are presenting our report to you as the Portfolio Committee. Strengthening data collection, M&E, and research stimulate robust and sustainable economic growth aimed at reducing poverty, unemployment, and inequalities. That is goal number 7. In terms of governance, We have the chairperson and deputy chairperson. The chairperson was appointed by the minister, and me as the deputy chairperson, I was elected by my colleagues who placed a lot of trust in me. And I truly trust that I am living up to that trust that they've placed in myself. The functionality, it is functional, the office of the chairpersons. And what we do need, however, is a strengthening of our secretariat support. The executive committee is functional, but it also needs a strengthening of secretariat support. We've got portfolio committees, the programs and projects committee, communications and marketing, governance, research, development, monitoring and evaluation committee, and then finance, social and ethics committee. So we've got these 5 committees and all of them are functional, but all of them still also unfortunately require a strengthening of secretariat support. The general committee is functional, so we are having all our meetings as they've been scheduled, and this is the highest decision-making body of the CDA. Then we've got the extended general committee, it's also functional. This includes all the structures that have been identified above, as well as the provincial substance abuse forums and other stakeholders. Then we've got 8 functional substance abuse forums. There are 9 substance abuse forums that are supposed to be there in the country because we've got 9 provinces, but 8 are functional and 1 needs to be re-established, and that is the one that is in the Northern Cape. And they also require financial and human resources, which is why we indicated that we need to get on to engage the MECs. Local drug action committees, we've listed them as 259. Few are established and functional, however. Many still to be established, and established LDECs require strengthening and support. The situational analysis is that this report is submitted in terms of Section 56, which enjoins the CDA to provide a comprehensive description of how the country is addressing the above-mentioned challenges of substance use and substance use disorder. South Africa is still grappling, was still grappling at the time when we were working on the NDMP implementation 2019-2024 in the year 2021-22. We were still grappling with COVID-19 and its challenges and consequences. COVID-19 regulations taught the country important lessons, and restrictions included the complete prohibition of tobacco sales to minimize tobacco-related risk of severe COVID-19 infection, and alcohol sales to lower alcohol-related emergencies, such as from traffic accidents in healthcare facilities, and also free up space for COVID-19 emergencies. We saw how this sort of showed us that as a country, if we would be able to deal with our issues of alcohol, we would possibly see ourselves sitting much better when it comes to a lot of the issues and the ills that we are dealing with. And then the measures also restricted the nature and types of services that persons with substance use disorders could access and what services could be provided by SUD providers. This was an unfortunate circumstance that occurred because of the restrictions. But we are trusting and seeing from our reports that systems are getting back to normal, and service providers in the SUD space are better able now that we've moved away from that time of COVID, to provide the services that are so needed by our communities that are dealing with substance use disorders. The situation in South Africa is examined against what prevails globally, as this invariably has an impact on the country and its response to the challenges of drug and other substance use. So the global analysis sits as below. In 2020, 1 in 18 people aged 15 to 64 years had used a drug within the last 12 months. This represents an increase of 26% since 2010. That is from the UNODC 2022 report. Drugs killed almost 500,000 people in 2019, and drug use disorders resulted in 80 million years of health life lost, mostly due to opioids. That's from the report of 2021. The World Drug Report projects that by 2030, the number of people using drugs will rise by 11% around the world, and by as much as 40% in Africa alone, which is very, very concerning. the World Drug Report urges policymakers to note that illicit drug cultivation offers no way out for impoverished communities in the long run. That the drug trade has environmental impacts, and that drug trafficking, along with associated corruption and illicit flows, undermine the rule of law and stability. This is something that we as a country need to look at very, very carefully as we enter into the economic benefits of some substances such as cannabis. Because looking at this particular point, it leaves us with a question on how we will be able to manage all the issues that are going to possibly impact us once we get into that economic space. Markets for drugs are expanding to new and more vulnerable regions, and more young people are using drugs compared to previous generations. I think this is quite evident and it's quite concerning. And the portfolio committee has also indicated that this is a major issue that we need to look at. In Africa, most people being treated for drug use disorders are under the age of 35 years. This is also quite concerning, honorable members, because if we as Africa have a mostly young population, and this is what we are faced with, that drug use disorders are most prolific amongst people of 35 years and younger. It is quite a matter to look at and see how we can assist our young people to not then be trapped and be caught in this. 40% of countries reported cannabis as the drug associated with the greatest number of drug use disorders. The South African situational analysis is as below. We still do not have a national survey, unfortunately, on substance abuse trends in the country. South Africa is still dependent on the South African community epidemic, SAKENDU, and the World Drug Report, whose data is sourced from participating treatment facilities across the country. Obviously, we are all aware that not everybody who is who is affected by substance use disorders is accessing treatment centers. So it is quite evident that the data that we are sourcing is not enough, and we need to get the national survey on substance use trends sorted out as soon as possible. During the first half of 2021, 10,938 people were admitted for treatment across the 94 treatment centers, compared to 9,394 in 2022. So the substances that are listed as the substances that are quite prevalent in our country: methamphetamine. There's multiple method of use. Area of most use is Western Cape and Eastern Cape. Alcohol drinking, KwaZulu-Natal Central Region. Heroin, which is in Nyamupe, injecting, Gauteng, Northern Region, and cannabis smoking, Western Cape, Eastern Cape. Cats, oral, KwaZulu-Natal Central Region. Polysubstance use, multiple, Gauteng, Northern Region. Over-the-counter and prescription medicines, multiple, Gauteng, KwaZulu-Natal, Western Cape, and then tobacco smoking nationwide. It is imperative that a national survey on trends of substance abuse be conducted in the country, as I have indicated, to determine the trends and extent of substance drug abuse and the need, as well as the availability, accessibility, and quality of services to respond to the need. Alcohol use and abuse. South Africa has the 6th highest per person alcohol intake in the world, and the highest alcohol consumption rate in Africa, that is 11 liters per capita. The cost of drugs to the country are 12% of its annual GDP. 5th largest contributor to years of life loss with alcohol-related illnesses proportionally affecting socioeconomic groups. Purposeful targeting of markets in low and middle income countries, particularly young people, is a major concern for the CDA. Because I'm sure honorable members and chairperson and honorable chairperson again also allude to the fact that when you watch our television and you watch sports shows or any show that interests young people, you see just how many adverts that are coming through that are enticing young people to start consuming alcohol. There's research that shows that an association exists between alcohol market exposure and positive attitudes towards alcohol, earlier drinking initiation, and high levels of consumption. The national enjoyment of sports is also what is being used, and such as rugby and soccer, as I've mentioned, that there's a lot of advertising and a lot of marketing that is around our sports. There is a link between mental health and drinking, which is depression, risk of suicide, anxiety, low self-esteem, psychological distress, post-traumatic stress disorders, and others that have not been listed here. Social engagements tend to center around drinking. We, as the Central Drug Authority, when going through the provinces on our public consultation, one of the things that just kept on coming up was that whenever there's any event in our communities, alcohol is sort of like the center of what will be the enjoyment and whatever entertainment there is, even in our families. So the issue of drinking is really quite huge in South Africa. Alcohol abuse contributes to gender-based violence, HIV/AIDS, and other social and health conditions in South African society. We have engaged these stakeholders, which is the Commission on Narcotic Drugs, UN Office on Drugs and Crime, World Health Organization. We are actually sitting in the World Health Organization offices today at the CDA because they are very much in support of our work, and they are providing us with certain capacity that we might not have, like meeting rooms and stuff like that. The African Union, we are also very much engaged with the African Union now. The Colombo Plan, Brazil, Russia, India, China, and South Africa, which is BRICS, formal anti-drug committee. This committee we have not formally engaged with yet, but we are in the process of getting a meeting with them. But the rest above, we are very close, like working really close with them. And this has proved to be very beneficial to the CDA. The stakeholder engagement, when it comes to national stakeholders, we've got SANCA, ITTC, ICUDDR, ISUP South Africa, SANAC, SALGA, INHSU, SACENDU, SANCOD, and MRC. All of these provided us with reports which appear, which we've consolidated into our annual reports, which you have received. When it comes to performance management and monitoring, the departments, national departments and PSAFs, which are provincial substance abuse forums, they submit to the CDA their annual reports on their sector drug master plans, and these should be aligned to the NDMP. Ideally, on the national departments, the reports should be read against the sector DMPs, which should have been compiled and costed. The departments that have DMPs, which are the departmental master plans, are the Department of Social Development, Department of Health, SAPS, Department of Justice and Correctional Services, that always gets, which is under review. The CDA will focus on assisting departments to craft their sector and DMPs. We are already doing this, honorable members, to integrate the NDMP goals and deliverables into their strategic plans and key performance indicators. And I must say that we are getting a bit of traction here, and we are trusting that in the next report, we are going to have more DMPs. What is to note is that departments are complimented for submitting reports as expected and for attending CDA meetings. This has to be commended because as indicated when we started, and we just had 8. Now we've got 16. They are submitting their reports, they are attending CDA meetings, they are engaging fully with the CDA work. There's timelines for submission of reports. These were unfortunately not generally adhered to, but we are working to ensure that we are aligned, because one of the things that the departments have stated is that sometimes when we ask for the reports, they are working on their own reports. So we're working on aligning this accordingly. Departments are attempting to work together in clusters, and this must be commended, because one of the principles of the NDMP is that we have to work in collaboration. If we are not working in collaboration, we are not going to be able to see the impacts that we want to see. So we are quite glad that some departments are already attempting to do this. It is quite not an easy thing because the departments have been so used to working in silos and trying to change that. And I'm sure honorable members will also acknowledge that change is really not an easy thing to do. And the NDMP 2019 to 2024 is the first that has shifted from what the NDMP 2013 to 2017 articulated as how it should be implemented. So we are quite glad that they are working hard to do this. However, many departments do not seem to understand clearly the NDMP and the meaningful role that they can play. It would seem like a lot of departments still think that the issue of substance use and substance use disorder is an issue that the Department of Social Development should be dealing with possibly the Department of Health and maybe just the social cluster departments. Whereas we are pushing through and trying to make them understand that the NDMP has to be implemented by everybody, because the issue of substance use and substance use disorder affect all areas of society, and therefore all the departments have a role to play when it comes to that. In terms of the Provincial Substance Abuse Forum, the Eastern Cape, we received their report, they used their templates, and the only one that did not use the template is the Free State, as well as the Northern Cape. As mentioned, the Northern Cape is really a PSF that we need to resuscitate. So the report that they brought to us was not in the template of the NDMP. And then in terms of the reports, what they reported on in the NDMP goals, I did mention that there's 7 goals. So they reported, Eastern Cape reported on 4, Gauteng on 5, KZN on 5, Free State on 4, Limpopo on 4, Mpumalanga on 5, Northwest on 3, and Northern Cape on 1, and Western Cape on 4. And then in terms of the operational PSAF governance structure, the Eastern Cape has an operational structure. Gauteng is still to appoint a chairperson. There is a deputy chairperson that has been nominated, and a chairperson that has been nominated, but these are still to be formally appointed by the NEC of Social Development. And KZN, there are 2 deputy chairpersons. The chairperson is the MEC in KZN. So the chairperson of the PSAF is the MEC. The 2 deputy chairpersons in KZN have been appointed, and they are now engaging with the CDA in our work. And then Free State as a structure. Limpopo, the PSAF is to be relaunched in this current financial year. Mpumalanga, there is a structure. Northwest, there is a structure. Northern Cape, there isn't, as mentioned. Western Cape, there is somewhat of a structure. And then we've got conveners appointed by Department of Social Development in all. And then in terms of the resources, we unfortunately only have resources for KwaZulu-Natal and Mpumalanga. Gauteng does provide resources in terms of if the PSAF chairperson is to go somewhere, they are able to go and then come back and claim, which is really not a structure that we, in terms of allocation of resources, that we are compatible with. The implementation in terms of goal 1, the achievements were that we developed and engaged employees, crime offenders, basic education, school learners, parents in various substance abuse prevention and intervention and awareness raising strategies and campaigns. Analysis, the SAPS conducted 4,481 crime prevention awareness campaigns. In total, the national departments and entities reached out to a total of 73,432 people throughout the country. Our recommendations are that departments must conduct prevention and awareness campaigns in collaboration with other departments to rationalize the use of resources and have impact. This we are saying as the CDA, and we've said it to the departments and all of them, even the PSAFs, that there has to be a collaboration, because there's so much maybe wastage of resources, and we need these resources to do awareness campaigns, which if they were done in collaboration, we really would save some resources, the financial resources that is. The policy on prevention of and treatment of substance use disorder was developed and consulted with various stakeholders. And the recommendation is that DST finalizes the process towards the review of Act number 70 of 2008. Because we have indicated that we have engaged as well as the CDA with the department regarding this policy. Treatment and harm reduction, the National Departments of Social Development, Health, Correctional Services continued with providing treatment to users in the public treatment centers and correctional facilities, and they ensured adherence to norms and service standards. Our recommendation is that government upscales and funds more OTP programs throughout the country in order to reduce harm. The Department of Health, as an analysis, has developed and is piloting a comprehensive and costed opioid substitute treatment plan and clinical guidance for treatment of people with STDs with support from the WHO.
Sorry?
The other
Oh, something different. Yeah, I wanted to check the. Can I to check the SMS because actually normally I do the check-in fast. Yeah, man. Yeah.
Honorable Chair,
Jabulan, will you please mute your gadget? You are disturbing the meeting. Thank you. Over to you, Mslami.
thank you, Chair. Practitioners in treatment centers were trained and capacitated on the UTC curriculum and on psychosocial support guidelines. Peer educators were also trained on evidence-based treatment programs. The Department of Social Development also monitored the implementation of the strategy on reintegration and aftercare programs for recovering users. DSD is to provide numbers of recovering users that gain access to aftercare and reintegration services after treatment. The recommendation is that there needs to be an upscaling of aftercare skills development, employment, and entrepreneurship programs for recovering users. Non-governmental organizations were funded to provide outpatient treatment and prevention programs and were monitored for compliance with service standards. The database of these funded organizations is with the Departments of Social Development and Health. Monitoring of unfunded treatment centers needs to be prioritized. This is a recommendation that we have made to the departments that are in the space as the CDA, because we have realized that there are quite a number of unfunded treatment centers, and we need to do a better job of monitoring them. And there has to be a collaboration on this with the security cluster departments, because in some instances, some of these need to just be shut down. And then they can be able to assist with that. In terms of goal 2, the Department of Justice and Constitutional Development published the Cannabis for Private Purposes Bill 19 of 2020 in the Government Gazette. Public hearings were held, and the bill is now before the Portfolio Committee for a clause-by-clause reading. Provision is to be made to deal with harms associated with cannabis abuse. Cannabis use, that is. Alternative development strategies for communities affected by commercialization of cannabis is needed. I did indicate when relating the issue of the World Drug Report that this has already been highlighted as a space of concern that all countries need to be aware of. So we need, as a country as well, to come up with these development strategies, because once we roll out the commercialization web, we are going to then see negative effects. National Prosecuting Authority collaborated with SAPS, including the Directorate for Private Crime Investigations, to mitigate the supply of drugs in an effective manner. And CDA is to monitor the effectiveness of these collaborations on supply demand. Enhance the processing of forensic evidence for drug-related investigations. CDA is also to monitor this situation. And in goal 2 still, strengthen partnerships and monitoring chemical companies, and we receive import notifications on online system. SAPS managed to achieve 98% of finalizing import notifications and 93.7% of export notifications. CDA is to measure effectiveness and impact of these partnerships. As the CDA, what we wanted to do is to not just receive reports, but go further to say, in terms of the reports that we're receiving, if we're saying 98% and 93.7%, then what is the effectiveness and impact of these? Which is why we're saying that is a recommendation that we are making to our service. Address the illegal trade of liquor and other drugs. Liquor operations were conducted We undertook border post policing actions and movements, used enhanced movements and movement control systems on persons and vehicles, undertook actions targeted at drug trafficking in land ports, seaports, and airports. CDA is also to measure the effectiveness and impact of these operations. I must just add, in terms of the liquor operations, that the CDA has, in the current financial year, started engaging with all the liquor boards. We have engaged, I think, about 5 now. We are 6. We are still left with 4, and we are engaging them in terms to ensure that their operations are actually as per what they are in legislation mandates. There is going to be a report on this, honorable members, because we have already seen a lot of things that we believe as a country we need to be looking at. To mitigate the supply of drugs and liquor, the South African Revenue Service undertook 913 risk analysis and narcotics seizures at airports worth 409 million and 898 at 16 airports worth 31.4 million. CDA is to undertake oversight visits at airports to monitor this work. Goal number 3, the Department of Health and SAPRA implemented the controlled license and permit processes. CDA is to monitor this work. Just to add that we now have a representative from SAPRA in the CDA, and that representative is very, very active in the work of the CDA. And even at the meeting that we're having today, they are part of it. We've got on goal number 4, 7 cases where new psychoactive substances were identified and detected. CDA needs to encourage all other provinces to carry out activities under this goal and report back. We, on this goal, as per the previous slide, when I indicated, what was reported on by the PSAFs, this goal is one of the goals that needs to have reports come through from all the provinces, because I believe there was just one, if I'm not mistaken, that was quite clear on it. The rest did not report on this particular goal. Monitored the trends and composition, production, distribution of NPS, ATS, and other chemicals used for illicit drugs, and arrested 275 drug dealers. CDA will continue to monitor the trends of NPS. Trained government officials in NPS that happen in KZN, dagga, cocaine, crystal meth, and all those and other chemicals were confiscated in Gauteng and Mpumalanga. In terms of goal 5, which is the goal that relates to the work of the CDA governance in the main accountability, we've got the Department of Social Development, which delegated the Chief Director on Substance Abuse and Social Crime Directorate and employed the Secretariat comprising 2 social work policy officials and 2 administrators. So that is our Secretariat. The Secretariat of the CDA has limited capacity to effectively support the CDA. And our recommendation is that DSD is to employ a director as prescribed by the Act, and we are aware that the department is working on ensuring that this happens, as we have engaged the ADG on it, and he is on it. The CDA successfully held meetings with departments and entities toward the appointment of representatives. So 16 out of the 20 departments are now represented in the CDA. The 20 departments that we are referring to, honorable members, are the departments that are listed in Act 70. Only 4 of these have sector drug master plans. The costing of plans remains a challenge. The recommendation that we're making is government departments, entities, and PSAFs to develop their sector drug master plans. And as we have indicated, we are working with them to assist them to this. CDA delegated each independent member. So we've got the 11 independent members that we are interviewed by the portfolio committee and recommended. So of those, each has been delegated to a province in order to ensure that the PSAFs and LDECs are functioning, capacitated on the NDMP, and encouraged to report to the CDA. This we have found to be very, very effective, because whenever there's an issue with any PSAF or any issue in a particular province, the delegated member, who is an independent member, is able to quickly answer to that or assist the PSAF or the LDEC with whatever they need assistance with. Communication with provinces has greatly improved, and CDA will continue to strengthen these initiatives. We undertook a strategic planning session last year jointly with the government departments, and we developed a 2022-25 medium-term performance plan and a 2022-23 annual performance plan. This has enabled the CDA to prioritize our interventions, and committees of the CDA must continue to align their work with the APP, which is what we are doing. Involve stakeholders who are not necessarily members of the CDA to review the third CDA's annual report, which the fourth CDA had prepared. When we came into office, there was no annual report for that had been prepared for the year 2020-21. So as the fourth CDA, we developed that based on whatever we could find, and reports from the previous chairperson, as well as other information that we could get here and there. And then we are ensuring that there is effective coordination and collaboration on matters relating to the management of substance use, abuse, and misuse in the country. So after developing the report, honorable members, last year, we then had a stakeholder engagement where we brought in all the stakeholders, gave them the report because they had been working with the third CDA. So then we gave them the report and asked them to also comment on it, because as the fourth CDA, we had not actually been the ones that did the work. And they confirmed that the work that we had brought together and presented as a report was indeed the work that had been done in the year 2020-21. The CDA will involve these and other more strategic stakeholders in planning and reviewing the implementation of the NDMP, which is another reason why we are continuing even today to engage the stakeholders that are quite important and strategic. CDA has been encouraging government departments and entities to allocate budgets for the rollout of the NDMP. Currently, the amount available to manage substance abuse in the country is not known. So we are not able to give a figure on that, which is a challenge in itself, because if we're not able to quantify how much money is available, then it is a challenge to actually say whether the effectiveness of the use of these funds is something that is real. CDA will continue to pursue the allocation of budgets for the rollout of the NDMP. CDA has not had direct contact and engagement with the World Health Organization and the AU. This was the situation, honorable members, about 3 months ago when we prepared this report, but the situation has changed drastically in the last 3 months, because now, after pursuing very vigorously these two relationships, we now have them firm and strengthened, and we engaged with the African Union just last week with the Department of Correctional Services, and we are sitting at the WHO offices currently, who are working very hard with the CDA to ensure that the implementation of the NDMP is realized. SAHPRA has added 20 substances to Schedule 7 of the Schedules to the Medicines Act in line with the recommendations of the 63rd meeting of the Commission on Narcotic Drugs. All 9 PSAFs have been established in accordance with the Act, but only 8 are functional. Northern Cape is planning to establish the PSAF. We need to enhance functionality and resourcing of PSAFs. That's what the analysis has been. And the recommendation is that CDA is to ensure that the next PSAF is established, to ensure representation of relevant departments and sectors, ensure financial and other support to PSAFs. We've got 31 local drug action committees that have been established and are functioning at varying levels. We mentioned that there are supposed to be 259 in the prior slide, but there's actually 31 that are local, have been established and are functioning, and at varying levels. The CDA is collaborating with SALGA and the PSAFs to encourage and capacitate mayors to establish and support LDEX. And an audit of established and functioning LDEX has to be conducted. Goal number 6, the Department of Health has a contract with Sakendo, SAMRC, for Sakendo to collect data on drug use. The contract has been extended. Much more work still needs to be done to achieve this goal. And we will be able to report more on this, because the research development data and research development monitoring and evaluation committee has been hard at work pushing for this goal to be achieved. 4 quarterly reports were received. which highlighted a significant decrease, which is 51%, in the number of children arrested for possession or use of drugs. Goal number 6 as well, one province reported to have developed a provincial database and has conducted monitoring sessions for compliance of treatment centers with norms and standards. There's no national research agenda still, and there is no funding available for the national prevalence survey. What we have currently is just a small amount, which is really not going to be able to take us far. And we are continuing to engage the departments to assist us with this particular matter. CDA is to collaborate with research institutions to undertake the National Prevalence Survey on drugs and alcohol. And we do have this relationship with SAMRC, and they've already indicated to us different things that we can do in different ways that we can get around this, and which the committee, the RDM, is working on. None of the departments, unfortunately, reported on goal number 7, which is the economic development goal. Departmental representatives in the CDA have been alerted to report on this goal, as work is known to have been done, but it is not reported on. What we know, honorable members, is that a lot of work is done by departments in terms of economic development and bringing in young people to employment, internships. But for whatever reason that we are still engaging the departments on, this is not reported to the CDA. So we are engaging them to say, please, can they just ensure that they also report on this so that we have a clear understanding of what is happening in the country as regards the issue of economic development and skills development, and just an upgrading of the life of the economic life of our people. CDA is to engage the economic cluster departments in the 2022-23 financial year towards implementation of this goal. We have started doing this, and we can report that we are beginning to see a bit of traction in this area, and we trust that in the next report, the economic cluster departments will all be engaged in the CDA work. 7 provinces carried out activities aimed at reducing poverty, unemployment, and inequalities, especially among substance users who are recovering, including their families. All provinces that must execute this critical goal to address root causes of drug and alcohol abuse. CDA is to monitor implementation of this goal closely. In terms of the financial report, the CDA is funded through the National Department of Social Development's Substance Abuse Program. Members of the CDA include national departments that should allocate some of their budgets to combating substance use and abuse in the country in line with the NDMP. This is currently not happening, honorable members. We just have the Department of Social Development supporting us with the budget that they have allocated. CDA translated the strategic plan and NDMP into an annual performance plan, and this identifies the human and financial resources required for implementing the plan. The current position of the CDA comprises sound financial planning and expenditure monitoring principles. This cannot be overstated because we have a budget that we have absolutely no control over. We need to ask the departments to assist us, and then we are sort of like hampered in our movements, because as the CDA, we need to move quite fast in what we are intending to do. But we find that the control by the department, which we appreciate the budget, but the control and the human and financial resources allocated are really causing us a bit of a challenge in implementing our work. The majority of the budget caters for operational costs rather than being based on the outputs related to the implementation of the NDMP. The current budget is incongruent with CDA's national oversight role. And in terms of evaluation, the mandate is not to be an implementing agent of the NDMP, but to direct, coordinate, control, monitor, and evaluate the programs and activities of its implementing stakeholders at national, provincial, and local level. So this is a narrative evaluation of these reports, which were covered in more detail, which you can find in more detail in the report. Departments and provinces have not shifted their approach to align to the NDMP principles, which is the NDMP 2019 to 2024. And there's a strong focus on activities aimed at reducing social ills and improving the well-being of children, families, and communities, which is commendable, but contributes to a single outcome, and this is not sustainable. Reporting by departments in the security cluster reveals that the approach taken does remain punitive. The NDMP 2019-2024 approach to addressing drugs and substance abuse requires a comprehensive, holistic, and integrated multi-stakeholder response, and this is not yet the case. We cannot overemphasize this particular one, honorable members. The issue of not integrating our response is really a difficult one that we need to find a way around. Departments do not seem to be consciously working towards meeting their NDMP goals. Their efforts are mainly incidental. Departments continue to work in silos, except for departments within the security cluster, which is goal number 2, which seem to be working together, but to a limited extent. Most departments do not have departmental drug master plans. National departments and provinces are not working in tandem, as evidenced by departments not engaging in the PSAS. So what's happening at provincial level is the PSAF is established by the NEC, but then you find that the departments at provincial level are not engaging in the PSAFs, and such that they're not even aware of the issue of the National Drug Master Plan itself and how they need to be aligned into it. Provincial departments of social development have kept the PSAFs alive, and this must be commended and somewhat functional, albeit with few resources to sustain their activities and to function as independent substructures of the CDA. Concluding remarks in respect of the AR, we would like to just mention the current crisis in the country, which is over the last 12 months, various incidents of substance use, misuse, and abuse were recorded throughout the country. One such incident was the Inyobeni issue. We did go to Inyobeni as a CDA, and we were there represented by one of our members at the funeral, of the young people that passed on. And then in Gauteng, we've got the Nyaope Challenge, which has indicated that there's over 550,000 registered Nyaope users. And then there's been the Gauteng and KZN tavern shootings. There's been a nationwide community upheaval regarding the issues of substance abuse. CDA has responded swiftly in all the hard-hit provinces, calling for an integrated response as per NDMP 2019-2024. Members have also met with communities to better understand the issues. In conclusion, honorable members, we would like to thank the Portfolio Committee for this opportunity to present our report. And we are open to further engagements and support from the Portfolio Committee. Our recommendations are that the Portfolio Committee notes the report that has been presented, facilitate the implementation of the Cabinet decision on reconfiguration and repositioning of the CDA, facilitates the urgent establishment of the Interministerial Committee, facilitate the participation of the 4 departments that are neither participating or involved. I skipped this slide, honorable members, my apologies, in terms of the recommendations, which is what we are recommending in the annual report, is that there be a resuscitation of the Interministerial Committee to combat substance abuse, which used to exist, but at some point ceased to function. To reinforce the CDA Secretariat, which we have indicated that the ADG is working on, and we truly appreciate that. To strengthen stakeholder relations through the CDA hosting 2 national stakeholder forums per year, which we are working on as well. To develop a national research agenda for substance abuse. The CDA should develop a database containing data on SUDs ranging from general information to treatment centers and advances in research. Improve monitoring and evaluation. The CDA must develop tools to manage the submission of reports by departments and provinces. These recommendations are the ones that are appearing in the annual report, honorable members. And the way forward that we are proposing and suggesting to the Honorable Committee. The challenges identified require a more concerted effort in implementing the NDMP. I believe all of us here in this on this platform and honorable members are very much aware of the challenges that we are facing as a country. The challenges that we have identified above they do not encompass every challenge that is currently existing. But the response of the CDA is, as per below, that we are engaging the public directly to monitor the situation towards finding better solutions with communities. And we are believing that if communities are involved in the solutions, those solutions will find impact at community level. But if the communities are left out and the communities are not engaged, then we are not going to see a movement towards dealing with this challenge. The CDA is engaging national and international stakeholders for support towards implementation of the NDMP. The CDA is engaging all national and provincial liquor boards towards better enforcement of existing legislation and alignment of provincial liquor legislation. The CDA is also planning to host the third biennial summit in 2023, which is aimed at dealing with the current challenges and to allow more evidence-based interventions to be employed. The Act mandates the CDA to have a biennial summit every 2 years. So in the time that we have been in office for 1.5 years now, if we do not hold the biennial summit, the third biennial summit in 2023, we are not going to then be able to meet that 2-year mandate that is supposed to exist between biennial summits, which is why we are pushing to ensure that in the year 2023, we actually do have a biennial summit. All the above and more interventions will be reported on in the annual report. Thank you very much, Honorable Chair and honorable members.
Chair, thanks very much. That's the end of the presentation, but I thought that I would just highlight 1 or 2 things through you, Chair, which I think are important. The presentation has really provided an outlook or situational analysis of the state of substance abuse in the country, and we may have not been as direct on this, but we are very mindful that we're dealing with a very serious crisis here, which some have actually referred to as the third pandemic. And we understand the gravity of the problem, both in terms of drugs and substance abuse. And of course, we're also conscious of the linkages between substance abuse and gender-based violence, HIV and AIDS, dysfunctional and distressed families, crime, and of course, gangsterism. And we're mindful of these challenges. Now, also because of this is a very multifaceted sort of problem that we are facing with. It really requires for all relevant stakeholders to come together and be much more active in addressing the challenges. And we're of course concerned about some districts and some, or rather local municipalities not having established the LDCs that they ought to. And there's a need, of course, to upscale efforts to address these challenges. We're also very concerned about the limited financial resources that are allocated to fight the scourge of gender-based violence, particularly at the local level. But lastly, Chair, I thought it was important that I just highlighted the 7 goals presented in the presentation earlier today really hinges on the following areas to address and ensure that we deal with the issue of substance abuse. Let me just talk to 4 of those areas quickly. 1, what the technicians would call demand reduction measures, which the presenter may have spoken about. Now, this talks to preventative measures in the main, and talks to awareness campaigns, but most importantly, it talks to social behavioral change programs, which are fundamental if we're to shift the psyche and change the thinking around how we view substance, both in terms of alcohol and drugs in the country. And of course, we do need to upscale these to ensure that they reach all communities and all ages. We have started implementing a range of these programs, and a lot of them are actually very effective. One recently reviewed by the University of Johannesburg has also come out to be a very successful program in terms of its approach. However, this, in terms of the demand reduction or what we call preventative measures alone, would not work if you had to do it just alone. You can't address the challenge. You have to address a serious issue of law enforcement interventions, which is the second aspect I want to talk to very quickly. This talks to the law enforcement agencies, be it SAPS, be it the Hawks, be it SARS, be it Home Affairs in terms of the borders, the liquor amendment board, liquor boards, etc., and so on. We have to ensure that we see more arrests being made and more convictions with hefty sentences, which could serve as a deterrent. We have to see much more of these happening so that people can see that there is a change that is happening around substance abuse. If we do this, we'll avoid issues of drug trafficking, or we'll reduce them. We have to ensure that there's also closure of illegal outlets and taverns, as it were, but also ensure that there's monitoring compliance of conditions of trading. These are important aspects. Linked to this, in terms of law enforcement interventions, is an area around legislation and policy reform. And the presenter may have spoken about a few of these. The one I want to pull out, which is en route to cabinet, is the prevention of and treatment of substance use disorders. And this is a piece of legislation that we are currently looking at and amending so that we are able to take it forward. And the idea here is to really strengthen the interventions on the ground insofar as policy and legislation reform is concerned. A fourth issue, which is the last issue, which I think is a very important issue, is what the technicians would call harm reduction. And this deals with, I suppose, the aftercare or the recovery services that come post people being rehabilitated for substance abuse. And this also includes access to treatment centers, etc. So this is an important area that we are actively involved in. There are treatment centers that are run by the state, as well as those that are run by NPOs, and we support those NPOs in terms of ensuring that those treatment centers operate effectively. And of course, we set the norms and standards in terms of this, this aspect as well. Just lastly, on the legislation part, there's one part I really omitted to talk to. This relates to a range of other bills or policy interventions by other government departments because of the multifaceted nature of the challenge that we are dealing with. For example, the Liquor Amendment Bill. This is a bill that has not been amended for years. And if you don't amend that bill, there are areas that you're never going to be able to address in terms of substance abuse as it relates to alcohol. And there's a range of others that we can talk about, which require other government departments to move on. So the point I'm making is really that the CDA sits at the helm of ensuring that other government departments deal with these issues of legislation, and, you know, including ourselves. And by the way, we are actively working, the minister has engaged in terms of ensuring that the Interministerial Committee on Substance Abuse is revived. And we are working on that at the moment. I thought, let me just put those pointers at the end, Chair, which link to the aspects that the presenter has spoken to. But that's it, Chair, for now. We're then open to take inputs, guidance, questions, etc. From your good selves. Thank you very much.
Thank you very much, Linton. Honorable members, let's debate and discuss about this presentation and wish to welcome the presentation from CDA. Thank you very much, Linton. Can I give over to the honorable members? I see the hands of Honorable Stock, Honorable Bridget Masango, Honorable Gizela, Honorable Alex, and Honorable Bilakul. Can we follow that sequence?
No, thank you very much, Honorable Chairperson. Let me appreciate the presentation which have recently been done by the CDA board members, and then also appreciate the kind of work that they are doing since they've been appointed by the Portfolio Committee since the 1st of April in 2021. So one can really appreciate and start to, confidently appreciate the kind of work that the CDA is doing ever since they came into office. All the type of interventions and the programs that they embark on, it's really appreciated, and I would like to actually encourage them to do actually more throughout the provinces in areas. For an example, I've noted through their presentation through the provincial substance abuse forums. We still have provinces, for an example, that don't have the provincial substance abuse forums. Like for an example, the Northern Cape, we are being informed that there's no fora in the Northern Cape. And then in Limpopo, there's no fora, but the province have made a commitment to actually relaunch the forum in the 2023, 2022, 23 financial year and so forth. So one would actually like to encourage the CDA board members to be more vigorous in dealing with the provinces to ensure that throughout the country, there's no province that in this age and era that there's no provincial substance abuse forum. For an example, I'm actually so concerned and worried, for an example, in the Northern Cape, where you are saying there's no provincial substance abuse forum. And then in the Northern Cape, there are high levels of poverty, unemployment, and the intake and abuse of alcohol is very high, including the drugs, in the areas of the constituencies where we are working. So I just wanted to highlight that particular point and bring it officially to the CDA board members to be able to deal with it as we move forward. Honorable Chairperson, the other issues that I want to raise, I've also noted in the presentation that the CDA did not provide the actual expenditure in their presentation. They only provided the budget allocation and expenditure on page 50 of the tabled annual report. Therefore, I would like to maybe just to also bring it to the attention of the CDA that they maybe highlight and just give us a summary of the actual expenditure. We actually note that the budget that they have is quite limited, but it will be important for us as members of the portfolio committee just to get the sense of what is the actual expenditure in NDA. And then my last submission, Honorable Chairperson, in terms of the 7 goals of the National Drug Master Plan, I've noted that goal 7 of the National Drug Master Plan, all departments, national departments have actually not reported in this particular goal. So it's a serious area of concern for me. And I would like maybe the CDA to take us into confidence as to what are the real reasons put forward by the national departments for not reporting on this goal as part of the National Drug Master Plan. Thank you very much, Chairperson. Those are my issues as I submit. Thank you.
Thank you very much, Honorable Stock. The next one is Honorable
Masango.
Yes, Honorable Bridget Masango.
Thank you, Chair. I just would like to thank the CDA for this presentation this morning and to appreciate also the energy with which the chairperson, the deputy chairperson, exuded as she was presenting, which for me takes us back to the previous CDA board that always, without fail, presented these challenges that they are having as they were presented today. I could not ignore the fact that each time the deputy chairperson was like to do or what they have done, they would say due to lack of capacity in terms of secretariat capacity, it seems like they have so much that they would like to do, but they can't do it because of lack of capacity. And that was made worse, Chairperson, when even the interministerial committee that is supposed to be overseeing this work is having to be reinstated, if you like, or reactivated, as it were. Now, this is sounding very. It doesn't sound well for us as the committee to have heard all this and to seem not to have done anything with the previous CDA board. And now we have a new board that is is making the same pleas in terms of capacity, in terms of the budget arrangement of how they are using their budget or how they have access into their budget. Because I believe the ADG did mention earlier on that in some circles or in some quarters, substance abuse is one of the huge pandemics in South Africa. And we cannot be seen to just, because it seems that the CDA is another box we are trying to take as the country, where there should be so much capacity afforded to the CDA to be able to do the work that they are having to do, because there is so much substance abuse in the country. But I thought I would also like to hear, especially maybe if not from the deputy chairperson herself, but from the ADG, is there an issue with the legislative framework that is governing the institutional, the constitution of the CDA that is causing all these challenges? We cannot afford, as the committee, but as a country, to have a situation where there is an authority that has no authority, because this is what is coming across. There is work to be done. The people know what work to do, but they have no budget. They have no capacity in terms of secretariat. I just would like to know from the ADG and what it is that is an issue here. Chairperson, I would like to also request that the APP that the deputy chairperson said that they have, to know if it can be made available to us as the committee, whether it's done legally or not. I just would like to know if that is possible at all. And also the consequence management for the departments that are supposed to be reporting or that are supposed to be submitting their reports that are not doing that. What then can be done? What is a recourse in as far as that is concerned? But lastly, Chairperson, and I have so much to say about this, because I don't believe we can afford the energy with which this presentation was done to wane because of the challenges that the CDA is presenting to us today. But the last thing that I would like to request, in fact, last two things. The first one is that when we have that workshop that we have requested, if the CDA could be part of that, please. And then number two, I would like to request that when the CDA does these oversight visits, if the committee, not in all of them, but if the committee could be part of those oversight visits. Because yes, we believe everything that was said here today, but maybe if we were there on the crime scene, as I would like to call it, it would give a different type of impetus in what we have to do within the bounds, obviously, of what we can do as a committee, but also in our proposals to the department going forward, in as far as this is concerned. Thank you so much, Chairperson. I really would like to thank the CDA for the presentation. Thank you.
Thank you, Honorable Masango. The next one is Honorable Gisela Opperman.
Thank you, Chairperson. We have not amended in years, currently been named the country with the highest incidence of fetal alcohol syndrome in the world. I'd like to know if there is any studies currently going on around the impact of fetal alcohol syndrome in classrooms and on teaching. And then I want to know, did they manage to increase the number of social workers dealing with substance use disorders? And if not, why not? And they also said that they agreed that the services are currently inadequate. So I'd like to know, what do they propose as a way forward? And how many local drug action committees were established for the period under review at local government level? And around the one in the Northern Cape, What constraints are they experiencing that have prevented the establishments of the provincial substance abuse forum? And I'd like to know what do they predict? What would the legalization of cannabis, how would it impact on impoverished communities? And of the 94 treatment centers, how many are in the Northern Cape? And who is responsible to report on the NDMP in the Northern Cape? Thank you, Chair.
Okay, may I proceed?
Yes, you can proceed, Honorable.
Thank you, Chairperson, and thank you to the Deputy Chairperson of the CDA and her team and the ADG for the presentation. Chairperson, my questions and inputs are as follows. I just would like confirmation from the CDA, that if they are actively engaged in awareness campaigns in schools and higher education institutions, because as we see time and time again, our learners are bringing drugs and, weed and what's the correct term, marijuana into schools. So are these awareness campaigns ongoing in schools? Then the presentation spoke to the Niobe cases in Gauteng. And I recall the media statement from the Premier there stating that they are going to have a state farm type facility for these substance abuse users, is particularly youth. And I would like to find out, has the CDA visited this farm? Because I believe the press statement indicated that intake will be done from the 1st of November, and it's the 9th of November today. Then, Chairperson, my colleagues have mentioned the outstanding provinces that do not have their structures in place. But on the one slide where it indicated that so many provinces have not assigned, HRM budget, I'm a little concerned about that slide because, for example, there's a report that the Western Cape has not allocated HRM budget, when I know for a fact that the Western Cape does have a secretariat in place in the department, because I spoke to her the other day. So I do find that concerning that, it's reported as zero when there is in fact a secretariat at the Western Cape, and therefore I'm a little concerned about the other provinces that have been reported as zero. Then, Chairperson, just on the LDAC, and I think it's very telling, the situation of substance abuse. And if I go to page 53, in the annual report, and if I'm not even just looking at the LDACs that's been established, but just the mere fact of the LDACs that are functional, Eastern Cape, 0 out of 13, Free State, 2 out of 17, Gauteng, 0 out of 15, KZN, 4 out of 48, Limpopo, 1 out of 29, Mpumalanga, 0 out of 18, Northern Cape, 0 out of 26, Northwest, 6 out of 19, and Western Cape, 9 out of 26. And Chairperson, I think, the CDA has been doing lots of encouraging, and I think it's time to, show some teeth, because there's only so much encouraging, I suppose, the CDA can do to get these LDACs established. And it brings me back to this point I raise often, in that the MECs actually need to come to our committee and state their case, as well as SALGA, to actually get to the bottom of why these LDACs are just not functioning. Then, Chairperson, during the height of lockdown, our committee received a presentation from, I think it was the DG Murray Trust, and I stand corrected, I think the presenter, his name was David Harris or David Harrison, and it looked at the increase in the price of alcohol. And maybe this is a question for the department to answer. I'd just like to find out, how far this process is, or what actually happened to that engagement with the DG Murray Trust, and how far the department is at looking at, increasing the price of alcohol. Then, Chairperson, the CDA did mention they work with the liquor authority boards, but does the CDA have an indication of how many illegal bottle stores and taverns there are in communities and residential areas? And if if they have the numbers, will they be able to share that with the committee in writing? And similarly, you know, what has been the involvement with SAPS, because SAPS know where our drug houses are. They know where the drug houses are, yet they remain open. So I'd like to know what CDA is doing with SAPS in order to get, you know, these drug houses closed. Then Chairperson, slide 23, and it speaks to the vacant post of the Chief Director on Substance Abuse and Social Crime Directorate. And I'd like to find out, and maybe this is also for the department, you know, how long has this position been vacant for, and when will this position be filled? And it's quite concerning, Chairperson, that the CDA states that there's no national research being done, especially when we have a research unit in DSD, we have a research unit in the NDA, and there are many other stakeholders with the research units, such as the MRC. So if they can maybe just elaborate more as to why no research is being done when there's all these in-house government entities that can do research. I just find that very bizarre. Then, Chairperson, my colleagues have touched on Goal 7 and the fact that no departments have reported on it. And I find that very concerning, especially since as members of parliament, all we've been hearing this term is the president's plan for economic growth. And to me, if departments are not reporting on this goal, it means they aren't taking the president's economic growth plan very seriously. So that is something, Chairperson, that I think as a committee, we need to look further into. And I will express the same sentiments as I think the Honourable Stock did, in that the CDA must submit their financial statements, the complete ones, the ones that indicate, you know, what was spent on accommodation, what was spent on meetings, and so forth, in order for the committee to properly look at those financials. Because once again, we see, I wouldn't call it the entity, but the CDA, and you know, we have it in the NDA, where compensation of employees is outweighing, you know, the actual action. Because I also see there's been no transfer payments, and it's stated as zero. And I just would like to find out, does the CDA do transfer payments? Have they done it in the past? And we know, why has there been no transfer payments for this reporting year? So Chairperson, that is my inputs. Thank you so much.
Thank you, Honorable Alex, and then followed by Honorable Paulnit and Honorable Mfika, and then Honorable Kate Wilangul.
Thank you so much, Chairperson. I also would like to thank the CDA for this presentation. You know, it just makes us think that, you know what, there's such a big problem that we are having in our communities when it comes to drugs. And I think this problem of drugs is also the reason why we're having a high crime rate, because these drug addicts, they will break into a place just to go and steal in your house, to go and sell these items, TVs or whatever, electrical appliances, just to get the next fix. And then we also have a concern at schools where the drugs are been taken into schools, but then also the alcohol abuse in our schools and within our youths. And then we look at the teenage pregnancies because of these abuses that we are having in our communities. And like the gentleman was saying, that they are still having the old liquor bowl and nothing was done about that. If we look at the Eastern Cape, where all these young children in a tavern or whatever you call it, the pub, died because of what happened within that things, is that there's no rules in order when it comes to these liquor facilities like the pubs and the clubs and all those things. Underage children are going there and no one is asking questions. And then we have a problem. I want to know what the department is doing with this thing. They say they have these rehabs. How many rehab facilities do we really have that is from the government? And then the NPOs that is having these facilities, sometimes government makes it very difficult for them to operate because of all the rules and regulations. Because I have a rehab in my street. It is a reach out victory, what do you call it? Victory outreach is the name, but it is people that is doing praying. They are just using prayers for people to rehabilitate themselves, and they don't pay anything to go in. It's a free thing. But every time the government comes in and they give these people a lot of nonsense. But the thing that I want to say is that with this drug abuse, chairperson, people become mentally disabled, after using drugs for a long time. They will see people walking in the street, they are mad as hell, and then afterwards it becomes the state's responsibility, because then they will get a state pension afterwards. So I want to know, is there any link to this too? Are they working together? How are they doing it? And then also, like my previous colleagues were saying, is that the alcohol syndrome children that we are having on the farms and in the rural areas, children that can't learn, that become disabled afterwards because they cannot progress, they cannot do anything in life. It also becomes the state's problem, because afterwards the children are getting a SASSA grant and all those things. So I just want to know that the alcohol abuse and drug abuse is the reason why we're having all the evils in our communities. It is crime that is high, stabbing, a person that is highly drunk or rape an old woman of 80 years old, next morning don't even know that they have raped a woman of 80 years old. So this thing, it is a very, very important thing. And for the CDA to come and not have a proper financial report to say exactly what it is. They know their frustrations and everything, and we need to address that as well. But we need to know exactly what is happening, and especially in the rural areas, Chair. So yes, this thing is a big thing, and I think it's the first time they come and report again for this year. But I think we should follow up on these things and see what is happening with the CDA. Thank you, Chairperson.
Thank you, Honorable Punit, followed by Honorable Ziko.
Thanks, Chair. Good morning. Let's also appreciate the presentation. It presents a very bleak situation. Firstly, for me, is reading the 7 pillars of the CDA, and it's an authority, but has no authority to enforce. So for me, Chair, there's something probably that we need to look at, that we can't have an entity that is called an authority, but can't authorize anything to go forward. It's dependent on interministerial and interdepartmental for its programs to be able to move off the ground. Also, the complaint that comes through that they don't have control over their own funding or budget. That for me presents a problem, that how are they going to implement any program if they don't have control over their budget? Just a few points also to follow, Chair. The LDCs, local drug committees, we are supposed to have 249. And my question is 249 countrywide, when we have LDCs are supposed to be on the wards. We have wards, and we have more than 249 wards. Currently, we have about 31 or so that are in existence. So our fight against drugs in our areas is not really getting off ground. And what would be the challenge in rolling out to the 249, if anything? But I'm still saying that we have many wards, more than 1,000 wards in the country. And the authority is supposed to be looking at the country, not to particular provinces. Also reading the report, Chair, the focus is on other types of drugs, but not on Nyaope. And working with the community, one has realized that all these other drugs do exist, but the young people are addicted to Nyaope, and their state is not very good, borders on mental illness as well. So I would want to understand, why are we not focusing on Nyaope as a measure of releasing or relieving young people from the pandemic? And I'm saying the pandemic because of the spread and impact that it has on young people. The report says more young people are using drugs, Chair. What I want to know from the authority is what collaborations have we done, leaving out LTCs, but with other NGOs. And based on this is my worry on the collecting of data, Chair. That data is collected from treatment centers, and treatment centers are not giving us factual. We wouldn't make a synopsis on the amount of the impact of drugs in the communities because not everybody goes to the treatment center, and the report does say that, so we can't say we have a clearer picture on the impact of drugs if we're only using the treatment centers that not all addicts would go to. So I would want and I hear and appreciate that we're going to have a summit very soon, but the summit is not going to give us a real picture of the impact of drugs, especially in Nyaope, on our communities, and more so on the elderly, because the people that are affected by these Nyaope users are the elderly and the vulnerable, also women and children. A lot of GBVs is done by people that would have been not having had their fix of Nyaope, then they're fighting with everybody. The report also says, Chair, that a national survey should be done, but it doesn't give the person or the department responsible of that, because I think if we do the national survey, probably if resource and time allowing before the summit, we will be able to have a clearer picture of what are we taking to the summit. Because if we don't have the survey and we don't know what are the critical issues and issues that the amount of drugs that is available and inflicted in our communities, what are we taking to the summit? And I'm still saying the summit is a good thing, but there need to be a precursor to the summit and spade work that has been done that we are taking to the summit, because we've done research, we've done surveys, we know what are the critical issues that we need to address going to the summit. My last point here will be on the PCAFs. I'm picking up a sense that they're not necessarily capacitated to deal with the problem. So what measures is the authority thinking should be done in government empowering PSAFs for them to be able to do their work? Last point is that I'm disturbed by the fact that the Interministerial Committee is now redundant, and the authority suggesting to the Portfolio Committee to resuscitate the Interministerial Forum. I guess it's something that we could raise, Chair, when we speak, but the department, the acting DG, must be able to run with resuscitating the forum, because I don't think as an oversight committee, we can be able to accept speaking about it and raising the issue with the minister. So the committee has its work. It's a difficult job, but I think them not having the authority to enforce anything will not necessarily take us anywhere. So we probably need internally with the ministries to discuss the authority not having teeth to cut, because then why do we have the authority if they can't give any instructions to anybody? It doesn't really make sense to me. Maybe as we engage with it, we will have an understanding as to how does it become an authority, but it has no authority to enforce or instruct any other entity or department to participate in the programs. Thanks, Chair.
Thank you, Comrade Mfiko. Honorable, who's this now? It's Honorable, okay, Honorable Kate.
Thank
Where-
you.
Yeah, okay, over to you.
Oh, Thank you, Chairperson. And good morning to honorable members and everyone in this platform. Chairperson, let me join other members in commending the report that has been presented to us by the Deputy Chairperson of CDA. The report is promising when following it. But what I want to remind the members of CDA is that members of the Portfolio Committee are not impressed by the reports, but they are impressed of the work on the ground. So I just want to conscientize them that they must bear in mind all the issues and the challenges that has been raised by honorable members. Chairperson, the stats that has been given by CDA, according to me, it's confusing. Under the South African situational analysis, they made mention of 5 provinces that I think they mentioned the 5 simple because they think is the only provinces or maybe that have the high number of alcohol and drug abuse. But Chairperson, we sometimes sit with police giving us the reports or the stats. Limpopo comes number 4. And on their report, I don't see where they've mentioned the drugs that are mostly found in Limpopo. That is why I'm saying this, Chairperson, to say, to me, the report, it's not up to scratch. I think next time before they present, they must check with all the departments. More especially, they did mention the issue of SAPS, the Department of SAPS there. But the stats that what they've given to us and the stats that we receive from SAPS is not the same. Also, the issue of financial report, I think Honorable Stock did mention the challenge because their report is silent about their spending. I think we need to be updated on how are they spending as CDA. I think all of us notice after their report to say they are not in charge of social development is the one who is controlling their monies. But I think the one that has been given to them, we ought to know how they are spending. And while we're still there, Chair, I think it's good if they can also privilege us on how they do their, how do they claim? Is it per meetings? And is it all members of CDA that are attending or some meetings exclude other members? Just to be clear, in order to follow up what they are doing. And performance management and monitoring. The report indicates that departments are not adhering to the timelines on submission of reports. But also, there was a point, I think the last point on that slide, to say it seems as if the departments, some departments don't understand what they have to report of. So I think a workshop is needed or some other awareness to the department in order to be sure of what is expected out of them. Chairperson, there is this issue of appointment of social workers, which I think is a challenge. We know very well that the Department of Social Development doesn't have money to appoint social workers, but there is a need. Can't CDA also maybe make mention of have in their plans to, while meeting with this other department, to raise it, that maybe all the departments like education, SAPS, to have social workers that will be appointed on the department, on those departments, in order to assist. Because sometimes when we talk of schools, they also need counseling. Even when they go to hospitals, they do need counseling. But for now, I know of social workers that are seconded. They are not there every day, but they are seconded. They go there sometimes. But I'm talking about those that will be appointed by that particular department to be there in always in order to take care of the situations that may arise on that particular time. Another thing, Chair, is I just want to check the relationship between DSD and them in terms of the support to their work and the resources and the tools of trades. And then on the issue of some other provinces where they don't have forums, I think this one been raised also by Honorable Stock. It's not Northern Cape only. I've seen even in Limpopo. In Limpopo, they did mention the issue of relaunching. What happened? Can they privilege us about the issue that happened, that now CDA is to go and relaunch? I also want to raise the question about the situation, Chairperson, in our border post in terms of drug trafficking and what are the drugs smuggled into our country and those that leaves the country. What are your intervention strategies to address, or which borders did you visit once as CDA portfolio, as CDA ever since your appointment? The issue of budget, I think they did raise the budget allocated to them. It's not enough. But with that little that you have, are you managing to execute all your responsibilities that are ahead of you? Last Chair, the issue of local drug action. Is it there launched in our local municipalities or not? If not, what is the turnaround strategy? Thanks.
Thank you, Honorable Kate. I think I have missed it on what's going to happen in terms of these areas that don't have these centers. I might have missed it. If I can again be reminded what's going to happen, because I heard the presentation is mentioning that there's still the ones that are outstanding. I think honorable members have asked some of other questions, which I might not again and again emphasize on them, but there's still a lot of work to do in our country. Members have highlighted that. And really the way that we think we need to get the report, it's fine for the presentation for your first time, but it will be very, very much appreciated if we are implementing all the plan that we have put forward to us. Can I give over to you and your team, Deputy Chair?
Thank you very much, Honorable Chair and honorable members, for your questions. I've got the EXCO members here of the CDA, Ms. Kela and Ms. James, as well as Ms. Mabue. So, Ms. Mabue, I will ask that you respond on all issues that pertain to the project as the Finance, Social and Ethics Committee Chairperson.
Thank you, Honorable. Let me check for if I'm given permission, Honorable Chairperson.
Sorry,
Chairperson.
You can proceed.
All right. Thank you so much. Honorable Chairperson and the portfolio committee, all members and all participating on the platform. With the CDA, we have a challenging scenario in this manner relating to their budget. The budget of the CDA is part of the budget of the program on substance abuse in the department, which means we will then be allocated funds that will fall under that particular program. And in terms of the direct operations of the budget, any transactions of the budget have to be done through the program, where we would have different signatories to be able to, up to the acting director general, to be able to transact on any requests that we would have. So what has happened previously is that we will be given an allocation of a budget, which will be divided into 3 components. But I'm going to request that we submit the budget as it comes from the Department of Social Development to the Portfolio Committee. Here, I'm just giving the outline as one of the Portfolio Committee members has said, how do you operate financially? So that's why I'm just giving this particular background. When we would make a submission that we would have actually allocated a budget for. Let me give an example of tools of trades. We would allocate a certain amount for tools of trades, but when we would make a request, we will have the processes, the procurement processes of the department to be able to procure any of the items. And the challenge has been that with the numerous submissions that we have done, we have not had the benefit of being able to have a number of tools of trades that have been requested being procured because of either internal processes or at some point there was also an issue of the regulation from Treasury not to spend, though we would continually submit to the department to be able to get assistance. And so that is the one hurdle that we have, because we don't, that's why around the budget is that a portion of that budget is actually spent for compensation of employees, which are basically the members of the secretariat that are paid out of that budget. We don't have control of it also, as the payments are done through the department. And the other component of the budget is that which we have allocated mainly, as the DC indicated. Most of the budget is not actually responding to the National Drug Master Plan because of its limited allocation. The one component that we would say would respond to it is the part where we allocated $1 million for research. Actually, the initiation of the national survey, but also working with stakeholders and partners. And that process, the submission has been done to the department, is just to be implemented where there would then be procurement. It is just that we are not able to also choose who can work for us. We would have to follow the procurement processes, and the department would then follow the supply chain processes to be able to then give us whoever will be rendering a particular service. I'm mentioning it specifically around research because that was a reason why when there was an allocation last year, it could not be utilized because there could not be, the processing did not unfold as it should have been. So those are some of the challenges that we are sitting with in terms of the transactions. But now to the budget itself. When it comes to claims, we only have what we would call independent or expert members who would claim for sittings of the meetings, who would also claim for transport and accommodation when we have different engagements, be it provincially or nationally, and also for particular work that would have been done. For example, we were asked that we keep on saying there's a capacity challenge with the secretariat. Some of the members of the board had to work on the annual report for its production. Therefore, you'd find that when there is a reflection of the payments, it would reflect that there's a certain portion that has been paid to certain members, independent members, for the work that they've done on the annual report. But unfortunately, what I am explaining, you would not necessarily, honorable members, see on the financial statements that we receive from the department, because in the engagements that I've had with the department on behalf of the CDA, we received feedback that the system does not recognize. For example, we cannot say board member X has received so much of payment for so many meetings for their particular expenses. We don't have that kind of report financially, because they say they are not able to have it on the system. So they give us a lump sum to say you expend so much for such percentage for this particular item. So I'm just clarifying these things so that it is understood why it was a challenge for us to actually have a report, because we asked a financial report that we needed to submit, but it did not have detail to speak to what we know the portfolio committee is asking for. Though we will still ask the department to furnish us with what we have for record to be able to give to the portfolio committee. And in the year in question, lastly, we did not, okay, we came into office at a later stage. We only inaugurated in the month of May, and our operations with induction, we started actually operating more meaningfully from July. So the transactions for the previous financial year became limited that way. That at the time when we had made certain submissions, that's when also we were informed that there are no transactions above 30,000 limit that could be spent on. And therefore, it's as though the CDA did not spend with the limited budget, whereas it is internal processes in many ways that has costed the CDA to not be able to spend its limited budget. Let me then leave it at that. Through you, Chairperson and DC, even though there are any further explanations, I believe we would also be able to give them. However, we will request the department again just to give us the statement as is, even though it would not have the breakdowns. And okay, there was one question lastly about who claims. The only CDA members who are claiming direct budget are the independent members, the 11 members, but the departmental members of the CDA usually are covered by their departments for transactions. It's only on certain occasions where when there are extended meetings that there would be catering for other members, but not anyone who is in the department. Thank you, Chairperson and DC.
Thank you, Member Bowe. The one that I would like for you to mention to the honorable members is the exact amount of the budget and how it is structured in terms of the total amount and how much goes to the CDA expenditure, the direct, and then the part that goes to compensation of employees, which is the secretariat. Okay. Okay. I'm not sure if she's muted. Honorable Chair, may I move to the next member of the CDA?
Oh, I'm sorry, I realized that I was muted. I was saying that because I am using the phone, the access will be a little bit of a challenge. Let me get the information differently and then I can be able to share it appropriately.
Thank you, ma'am. Ms. James, please answer on issues of the rehab centers, the alcohol and drug abuse in schools, as well as how we as the CDA are intending to work on those issues. And then the rest of the questions will be answered by Ms. Keller and myself. Ms. James.
Thank you so much, DC, and thank you so much, Chairperson, and thank you to all honorable members for having us this morning. I'm Darylene James. I'm the deployer to Gauteng, and I also serve on the Central Drug Authority. In terms of our response to the ongoing challenges at schools with youth abusing and using substances, we have been engaging various organizations that are working on the ground, and I was very pleased to hear one of the members saying that, you know what, all good and well that we have this report, but you are interested in terms of what is happening on the ground. We are on the ground going above, you know, our call of duty, ensuring that we are visiting communities that are affected by substance abuse, where you have a high school dropout rate. We are also in talks with the Department of Education to ensure that at our schools, we actually have a policy that speaks to substance use disorder and also speaks to the steps taken when learners are caught abusing and using substances. I am from the community of Eldorado Park, and you may have seen the activism from the community stakeholders taking charge and taking lead in the community. And what we are doing, we are empowering by hosting workshops, capacity building workshops with various entities. That includes the school governing bodies, that includes the principals, as well as NGOs and organizations that are working on the ground. What we are also doing, we are putting recommendations forward that we should be having stakeholders and NPOs linked to schools that are affected by alcohol and drug abuse. We are also capacitating, like I said, your SGBs, finding a space to capacitate the SGBs in terms of, because we still find that, you know what, although our constitution states that children have the right to education, we still find that a lot of children are being sort of, the punitive approach is still taken, you know, where the cops are being called in and we don't see the effective diversion programs. So we are working on strengthening those diversion programs as well. I must be honest, I'm very proud to be part of the CDA, especially because it's a CDA that is on the ground and that we are ensuring that we capacitate and we empower communities to be able to take charge of this pandemic that is affecting our country. Was there anything else, DC, that I needed to speak on? Let me just see.
On the treatment centers, ma'am, the private treatment centers, yeah, and the rehab treatment centers.
Okay. We also spoke, one of the members also spoke earlier on about, I remember she spoke about Victory Outreach Center, which is a treatment center. I am familiar with them, and they have more your spiritual approach when it comes to treatment centers. Although we are aligning ourselves to the principles of the National Drug Master Plan, we cannot basically dictate to people what type of treatment is taken. And it also needs to bear in mind that, you know what, some users choose that they want to go the spiritual route, although we have to also ensure, and we have also discussed with the department, that we need to strengthen efforts to ensure that all rehabilitation centers are registered according to the minimum norms and standards. There is also a program, or if I can call it a drive, that we are embarking on to ensure that we strengthen also community, we educate and empower communities on the importance of how can I say, placing their children at a registered treatment center and not these. We see a lot of unregistered treatment centers. We have also engaged the department to ensure that we support the centers that are rendering services where they are not registered, you know, and we guide them in terms of what the requirements are. I unfortunately don't have the spread of One of the members asked about, I think it was the Northern Cape of the government funded treatment centers. How many are in the Northern Cape? We'll just have to get back. I don't have that sheet right in front of me right now, but I know that because I'm deployed to Gauteng, I know in Gauteng we have over 1,100 subsidized beds. These beds aren't also fully utilized. As DC mentioned earlier on, we have a great challenge with departments working in silos. So these beds aren't being accessed the way it should. But I think after this meeting, I shall provide a list to the committee, showcasing where all the government funded rehabs are and how many in each province.
Okay, thank you, ma'am. I will allow Ms. Keller, who is in the room, to answer on a couple of the other questions that came from the honorable members. And then I will close off on answering the few that she would have left out.
Okay, thank you. Thank you.
Hello.
Yeah. Apologies for the delay. We can't set up with two computers. We have an echo here. So that's why we're just trying to connect ourselves. Chair, I will respond, just run through the questions and respond as far as I possibly can. I think firstly, maybe let's appreciate the comments of the portfolio committee and the acknowledgement that a lot of work and just has gone into the work of the CDA in its first year of operation. And I think it's important for us to note that the report is for the first year of the functioning of the fourth CDA. And there's a lot of work that has gone on since then that we might be reporting on, and then we might still find in our annual report for the current year. So I just wanted us to clarify that the report and the presentation just looks at the financial year in question, the year under review. And just in terms of the question, I think we really have given a lot of attention. First, I'll address the issue of participation of departments. As the report has indicated, we are pushing, we are engaging, and one of the members said, we shouldn't be nice. Time for being nice is over. People must just come to the party. And we are trying to get them. And we felt that rather let's engage them so that they understand why they have to participate in the CDA. And in terms of, and the response so far has been good. And we have also alerted the minister to the fact that these other departments are not participating, and we've requested the minister to follow up with the four departments that have not been participating, and letters have been sent to those departments to ask them, but I'm not sure where the process is now. We're still awaiting feedback from the minister in that regard. In terms of consequence management, we really have not, the Act itself provides that if the departments are not participating and they are not doing what they are supposed to do, we need to report them to Cabinet, and Cabinet must take decisions around this area. And Chair, if we do that, we'll do that through the minister. But I think it's important for us to just say that there have been engagements also, and maybe the Active DG will report on that, with efforts around these areas, and to just explain to them why they have to participate. Sometimes people don't even understand what we are trying to do, the National Drug Master Plan and what have you. So it's also about building the capacity of these departments, because once they get to understand what we are doing and what the National Drug Master Plan is saying, they tend to want to participate. And the process is ongoing. With some departments, really we've had a positive response, but the other departments, the ones that we've mentioned, that we still have to engage more seriously. But there are consequences, but we've decided to take a softer approach But then we note as well that we cannot do that forever. It's something that we have to address and get response on. The issue around the concerns that are raised about also departments not reporting to the extent that we expect them to report. We have, actually, this is the first time that we've come up with an assessment, an analysis of reports that we get from departments. Previously, these reports just used to be piled up and attached, and that would be it. But we've now made departments, and in our compilation of the annual report, we're engaging with departments on their reports. And we've had situations where we found that there are duplications. For instance, the management of borders and that was mentioned by Adam and one of the members, the porous borders. It's a reality, we do have porous borders in the country. And I think it's something that is well known. And that's why we actually want to engage with the Department of Home Affairs as well. And we are engaging, in fact, with SARS. We are engaging also with SLAPS on this issue of porous borders to say how best we manage our borders in the country. But we also think that if we can get the capacity of PSEPs at the level at which they understand their role, they can also assist in terms of the provinces, because these borders are within provinces. What are the activities? I think we only got one report, and I'm not sure which provincial report was indicating issues around the borders to say how the borders are being managed. So it's an ongoing process, and we are actually engaging different departments, especially the lead departments in each of the areas that we have in the National Drug Master Plan. That process has now started, and that will also take me to the issue of liquor and the availability of alcohol, underage drinking, and all those things that are related to alcohol use and abuse, management of taverns, and so on. What we found, and this is work that we did in this current year, is that we have the National Drug something commission, I don't know what it's called, and then we have your provincial liquor boards. All of them have got different pieces of legislation. And I think it was, in fact, we've been informed that it's a constitutional issue. And what we're also finding is that the number of compliance officers that these liquor boards have vis-a-vis the licenses issue is very, very concerning. They've got, in one of the provinces, they have 4,000 liquor licenses issued, but they've only got about, 6, 7, not more than 10 compliance officers. So we're talking here about compliance in relation to licensed taverns and the extent to which they are complying with conditions of licensing. We are not even talking yet about the unlicensed taverns, but they reassured us, the legal boards reassured that they are working jointly with SARS so that they are able to apprehend and take to book those and shut down the unlicensed taverns. But also it's an issue of capacity. I think the amount of work that the police have and the additional responsibilities that we are putting on them, I think it's a matter that needs to be addressed, and perhaps with a better resourcing of liquor boards themselves to be able to do their own compliance work. And then, Chair, I think we appreciate the comment that we've had, and I'm sure that Deputy Chairperson will respond to the involvement of the Committee on Oversight visits. And I think it's something that we can do and that we can actually address. Chair, and let me address myself to the issue of FAS. FAS is a real problem in the country, but the concentration of the work around FAS has been in the Northern Cape and in the Western Cape mostly. There's a lot of research that has come, especially from FAR, FARR, on the extent of alcohol, fetal alcohol syndrome in the country, or fetal alcohol spectrum disorder in the country. And we actually looking at them and will engage them further, because the problem with FAST is that it impacts on children whilst they are in their mother's womb. And people get to know, and it impacts the minute you drink, when you become pregnant, it does have an impact on your child. So the challenge that is there currently is that whilst you can tell the tavern owners, please don't sell liquor to pregnant women, the pregnancy is only visible at a particular time. Also, the research that is limited at this point in time. These are some of the things that we want to address with the national survey, to say where is or what is the incidence of that, and what impact does it have on our children nationally, not just in the Western Cape and the Northern Cape, because you know this is a national problem. So we don't have evidence at this point in time as to the extent of us in the rest of the country. But there are already challenges even in gathering evidence or evidence that is available at the moment. The issue around the cannabis, I think it's a critical issue, and this is a concern that we've raised. We are looking at all pieces of legislation that have got an impact on the work on substance use and abuse, and we are making our own presentations to the departments concerned. And we are tracking also what happens in the different public hearings, whether there are public hearings and what have you. We've written position papers, we're busy writing position papers. We've written one on the policy of the department, and we are also we are looking at the impact of cannabis across the country, as the deputy chairperson, I think she addressed that adequately. To say that it is a challenge. There are harms that are not being taken into consideration. And also that we don't have, as in other countries that have legalized cannabis use, those countries have devoted a lot of budgets towards harm reduction associated with cannabis use. But we don't have that. And it's something that we are intend advising cabinet on, whilst we are legalized or deregulate, what is it? Whilst we are relaxing the laws around cannabis use for personal use and commercialization of cannabis, what are the other systems need to be put in place in terms of alternative development for people that have been producing cannabis legally, and also the harm associated with cannabis. I think Darlene addressed the issue of schools, but the Department of Basic Education is a member of the CDA, and we are engaging them continuously, because what we expect from these departments is for them to submit draft master plans that will address the very issues that members are asking, and to say in concrete terms, because they tend to just continue with the work that they are doing, but we want them to come up with those with the draft master plans so that we can examine them and see the extent to which they are providing services around substance abuse and the allocation of resources. We are not there yet. We are not there yet at this point in time. But I think maybe the last issue that I would want to address here is the issue around research. We have engaged departments, stakeholders, and other agencies, government and otherwise, around, and international agencies as well, around the issue of research. We set them all in one room and say, how do we do this survey, this national survey on substance abuse trends in the country? And the figures that we were given was, the figure that we were given was 10 million would be the minimum that would be required for that. And we don't have 10 million. Our budget in all is 7, and 4 million of that goes towards the personnel expenditure, and 3 million to goods and services. That's what we have. So the money that is allocated, or maybe it's the other way around, will assist. But the money we've allocated for a rapid assessment now is just 1 million. And yesterday, actually, we had a meeting as a research committee to say, how do we then, because it's not just issues around trends, you also need to find out about the interventions that are there and so on. How can other departments assist? And at the moment, we all know, and I think it's a reality, that departments have got their own budget constraints and don't have extra money to give away for anything else. So I think it's a challenge that we have. And it also, goes with the issue around budgeting to say, how do we budget effectively? And it's been a challenge because we are expected to submit our APPs and what have you at the end of the financial year when the cost has already bought in terms of budget. So we are looking at other options as well to say, how can we source additional funding from other partners and what other expertise can we draw from those partners? But it's something that we think is very urgent because it also saves us baseline. One member said that we want to know, we are not impressed by reports, we want to know what is happening on the ground. And in order for us to have baseline, we need to do those data research and that survey, and it has to be done as a matter of agency. And unfortunately, we don't have the resources to do it before the summit. We're going to piggyback on this other research that is available in the country. I think, Chair, I should just stop there. And maybe before I do that, maybe talk to the issues around PSEFs. That we as a governance committee, we are engaging with the PSEFs. We're trying to identify exactly the challenges that I have, because we talk about resources all the time, or there's no budgets and what have you. And I just want to clarify one thing. The budget of the PSEF, all the provinces have allocated provincial coordinators for the PSEFs. Now they would serve in quotes as secretariat for the PSEF. However, these people are also responsible for departmental programs on substance abuse. So that's where the challenge is. And there is no money for PSEFs to actually go out there and do the work themselves. They rely on the departmental officials. And they don't have the secretary, people that actually can assist them. And in some provinces, there's not even an allocation that has been made just for the remuneration of the members of the PSEF for the work that they are doing or attendance of meetings and what have you. So we're having PSEFs, a meeting with PSEFs now, we've been engaging them, but we're also having a meeting with them now soon for us to be able to really identify what challenges are there and to come up with a concrete plan for them moving forward, which plan must then be posted, and then you can then take that to the NECs and really engage NECs to ensure that there's allocation of resources. Thank you, Chairperson, and thank you, Deputy Chair.
Thank you, Chair. Honorable Chair, I'll just answer on the last three that I see that I've still left behind. And maybe just to add on the Western Cape issue of a designated budget, which Ms. Keller just referred to. When we're talking about a designated budget, is exactly as she's saying, it's not necessarily the funds that are running the convener's office, but it's the actual work of the PSEF that truly needs to happen. So that's what we are talking about when we're saying there is no designated budget for activities of the PSEF. Not necessarily the activities of the convener, because in the Western Cape, for instance, there is the convener definitely, as the honorable member said, is very, very much involved in the work of the LDACs. But then any other work outside of that, that's what we are talking about when we mention the designated budget. For instance, we are very much aware that whenever we are wanting or requiring that even the conveners themselves come and engage with us as the CDA, we find that almost all of them always have challenges in terms of budget, and they say that they do not have a designated budget to attend to the work of the CDA. And then the issue of the director, the ADG, I believe will answer on that. As I indicated, honorable members, we are aware that the ADG is working on this, but I trust that we will be able to answer further on it. And then the issue of the LDACs, which one honorable member Mfiko mentioned that there's 1,000 wards in the country. That is very true. But Act 70 mandates the mayors to appoint LDACs, establish and appoint LDACs. So the numbers that we're talking about here are the where local municipalities exist, where there's a mayor, because that's what the Act refers to. We have not trickled it down to the level of the wards to say in each ward then what is happening. But we basically are going according to what the Act says, and the Act refers to local drug action committees being appointed by the mayors, not down to ward level. Maybe that is one of the things that the policy. In the policy, we have that as one of the changes that need to happen, because the policy also has to speak to what is happening at ward level. And then the issue of the State Farm, the CDA is very much engaged with the Gauteng province. I am, in addition to Ms. James, I am the chairperson's office representative that deals with all issues that pertain to the Western Cape, Gauteng, KZN, and Northwest. So any issues that come up, just to build up the team, I also engage there. And we have been very much involved with the Gauteng province since just before the current premier came in, and we have engaged them regarding the issue of the farm. And we are not the ones that are in a position to explain more on what is happening regarding it, but there has been changes, and as the honorable member indicated, there had been a date that was put in place of the first, but nothing seems to have been moving. We do have some information that the province has reconsidered some of the plans that go around this. And just as an addition to that, I am going to be in a meeting with the Gauteng province tomorrow, the MEC, as well as certain social development officials from the province representing the CDA to discuss some of the matters, and I believe that this is probably going to be one of them that come up. On the matter of the appointment of social workers using the resources of other departments, that is actually an idea worth exploring. And Umekela, being a former social worker, would want to respond on this one. And that will be the last one.
Yeah, I think so. Unless we've left something. I think on the issue of social workers, yes, in fact, why we have a lot of unemployed social workers is because the initiative at that time when the social workers were given scholarships to go to university was that we had an interdepartmental committee that was looking at the needs in the country to say which departments would require social workers. The hospitals require social workers, schools require social workers, and the host of justice, I can name a whole list of. However, these social workers, when they completed their training, no arrangements were made for them for placement in those departments. And this is where why we have this gap that we have. And the president has indicated that, and the department as well, I think, have indicated that we don't have adequate resources. The country doesn't have money. But colleagues, honorable members, I think maybe some work needs to be done here, and maybe it's a work that must be done by the departments, by the Department of Social Development. And I think it's something that we have to engage them on, Deputy Chairperson, as part of our advice. But there is a need to look at the cost of social issues that we have to address, including substance abuse, domestic violence, crime, and all those schools and what have you that require services of social workers. And juxtapose that with the cost of employing social workers. Because really, I think if you were to employ more social workers in the country, you would be able to address some of the challenges that we have. Social workers are currently overwhelmed. They are expected to be everything to everybody, and it's just not possible. So maybe it's something that some work that needs to be done around the issue of social workers to say, what is the cost of social problems that we have to the country? Vis-a-vis the cost of employing social workers? Thank you.
Thank you very much, Chair. I see that there's a hand. I'm not sure if that's Major Pisa, who's a part of the state ExCom. Major Pisa.
Chairperson, Deputy Chairperson, I wanted to specifically respond to the question on why the PISA in Limpopo is due for relaunch. Because I'm deployed in Limpopo and I'm part of CDA. It was relaunched because after our appointment in April, the committee was not functional, the provincial committee was not functional. Then it was reappointed and relaunched in August, and it's now functional. That's my input for the Limpopo.
Thank you very much. I believe, Honorable Chairperson, we've answered all the questions, unless there's some that we might have missed, and we sincerely apologize for that. May we hand over back to you.
Sorry, Honorable Chairperson and DC, I had promised that I was going to get the figures for the 2021-22 budget. Am I permitted to just mention the three elements of it and the total? And then we will send it appropriately if it's accepted.
Yes, ma'am, please do that.
All right, thank you so much. We actually have three components in the budget, the last budget that we're reporting on. For compensation of employees, we had an allocation of 2.381 million. And that was on compensation of employees. These are the employees, the secretariat basically, let me put it that way. And then goods and services, we had a 4,483,000. And then there was the last one for transfers, of course, is zero. And then payment and capital assets, which was meant to purchase laptops and other tools of trade for the independent members. It was 81,000. And this amount could not be spent because the budget was far less than what was requested, even for the purchasing of a single laptop. So in the total, taking compensation of employees, goods and services, and payment of capital assets, the total was 6,945,000. That is the allocation that we were given by the department. Thank you, the Chairperson and DC and members of the Portfolio Committee.
Thank you very much, Member Mbowe. And the expenditure last financial year, we are said to have underspent, and I believe the members need to be aware of that. So of that 6 million that we had, we did not manage to spend it. And it is mainly due to the challenges of the bureaucracy around procurement. Otherwise, we would have, and in that 6 million, there's also that 1 million that is for research. So basically, it was actually 5 million in total. That, and if you take that 2.6 that went to employees, that would mean the difference is the total that was then left over for claims of members, travel, accommodation, everything else that's got to do with the work of the Central Drug Authority. And having said that, Honorable Chairperson, we truly appreciate all the questions that have come forth, as well as the advice. And we are definitely appreciative of the offer by the Portfolio Committee to join us when we go out to the communities. That would be of great assistance to us, because we do believe, as you say, that would assist with understanding exactly the challenges on the ground, as well as the issue of the APP. We are going to share it with the Portfolio Committee as soon as we are done with it, because right now, the previous one, we are reviewing it, which is the last year's one, because we are working on that, but it is also under review. And we should be able to submit it by end of January, if Mr. Maluleke agrees with everything that is in it currently, because that's the person that is going to be assisting us at the department. And with those words, Honorable Chair, I would like to hand over back to you. Thank you very much.
No, Chair, thanks very much. There were a number of questions that were also posed. Sorry, fine.
Chair, audible?
Thank you, Linton. I'm sorry the bus has arrived. Ne? Then we definitely have to be in the bus, but I'm sure we're on the finalization of the meeting for now. There was a hand of Mama Jane. Honorable Jane's hand was up, but she couldn't raise her hand in her gadget. Can we give her space? Betty? Meji? Hello.
Chairperson, are you saying, are you referring to me, Mrs. James? My hand
No,
wasn't up.
Jane. No,
Okay.
Jane, Honorable Mangani. Maybe she's not in yet. Then if you are done with answering our questions, I don't see any hand from the side of the honorable members. But let's hope for the best and thank everyone in the meeting and hope that we continue engaging one another. Since it's your first time presentation, we hope to have another one and we'll definitely meet.
Chairperson,
Hello.
the ADG did not respond, and I believe he was going to answer some of the questions.
Okay. Let's give over to the AG. Mr. Linton, acting.
No, thanks very much, Honorable Chair. Yeah, there were a few questions asked, and I'm tempted to respond to a few things that were raised by the CDA by way of correction, because I think there are some things that are not adequately put forward in a way that that are accurate. And I want to make just one example. The assumption that the first two things. One, the assumption that the funding must only come from the DSD is an incorrect assumption. And we must dispel that, because the reality is that we provide an allocation for issues related to substance abuse. Every government, every DSD in the province has a line item that deals with substance abuse. And it must be noted that funding for issues of substance abuse should not only come from the DSD. I indicated earlier that by virtue of this being a multifaceted challenge, it requires a multifaceted approach. So as DSD, we certainly have line items that address issues of substance abuse, including in provinces, but there are other government departments that ought to do the same, which they are not doing. So sometimes the assumption is that we are the only ones that must fund issues related to substance abuse. Is not the case. Secondly, the issue of there being a 30,000 cap on processing of financial matters is not an issue dictated to by the DSD. It was a treasury regulation that was put forward, and that was adequately explained. So sometimes these things need to be clarified and put forward, and have the context around that. I wanted to respond to that. I also wanted to indicate that there is no way that we can deviate from procurement policies or processes. We are guided by the treasury regulations and the PFMA, and we will stick to that to avoid any possible challenges that may befall us insofar as the AG is concerned. On the issue of the CDA having teeth, etc. Look, the CDA is an authority. It has the right to engage with various organizations. I met with the CDA maybe just over a month or two ago, if I'm not mistaken, and I asked the CDA to escalate issues that require escalation. I made that request to them because we realized that there are government departments that are not coming to the fore. And I think those are some of the areas that we are working on to assist the CDA. But the CDA has the teeth. And I thought that part of the presentation would indicate we've gone to Department X, we have not won, we have taken this step, now we are escalating and taking this step, because you are an authority and you have the ability to engage with the necessary institutions. And of course, I do know that one of the things we must request the portfolio committee to do is to assist us in addressing some of these challenges by way of holding relevant departments accountable. And I can give you one example, which I spoke to earlier, the Liquor Amendment Bill. There are certain things, and just to respond to one of the questions, you can't do anything around advertising and marketing of alcohol, neither in terms of the raising the drinking levels of, what do you call it? Raising the age of alcohol drinking. What is the other one on transport? The blood alcohol content. Your internet's gone. Raising the blood alcohol content. There's nothing you can do around that unless the Liquor Amendment Act is amended. For 5 years now, we've been pushing for that amendment. It does not lie within the purview of the DSD. It lies within another government department. We have been pushing through every structure that we belong to in government to try and make sure that this is taken on board and addressed. So on instances like that, that's a valid issue for the CDA to say, we would like the committee to help us in addressing this issue. Likewise, as a department, we have done so in various fora. I also think that insofar as research is concerned, etc., firstly, the post is filled, that one of the members referred to. The person is sitting across me here. The post is filled. Secondly, we do churn out research. We work with the MRC, I think it is. We also work with a number of institutions. I highlighted HSRC, who we are with in this building. I also highlighted earlier the universities that we've worked with, just one or so that I indicated. I must also indicate that post the meeting where Dr. David Harrison came to the portfolio committee on DG Marie Trust, we signed an agreement which is working very well. We have a program of action that we are working with to try and address some of the issues. But again, I must indicate there are some things that require legislative amendment, and those issues are important to be taken on board and taken forward. So we do have a series of research aspects that we churn out through our other partners and institutions, and we are working with 1 or 2 universities as well to try and address that. Some of the matters raised are really admin issues, which I again indicate require context to be put forward, and the issues that I've had a dialogue with the CDA on, and some of them we are addressing as well. What I would have loved to see, I suppose, is also, I indicated the extent to which some aspects are escalated, particularly in areas where there's no movement, be it local municipalities, provinces, etc. I would have loved to see and get a sense of how the authority has moved on some of those issues. But equally, what we would have loved to see, I suppose, and we are going to now initiate an impact evaluation on some of the work that we're doing around substance abuse. We're going to put that together. I've spoken to my colleagues here and really determine the impact of the interventions that we make. So we must be able to go into a community and ensure that the structures are in place. If there's no structure in place, we must ensure that we follow a process to address that. That's what we expect to see and expect to hear. We will also hold our government, our department accountable to the extent that we can, and other institutions accountable, at least as it relates to issues that we have control over. But I also think that the intervention spoken to earlier today must highlight a step change. So you must be able to go into a community and say, this was the issue, this was the challenge, the intervention has been deployed, and now there's a change. And this is the value of the impact that is being forward. This is why we want to do an impact evaluation on some of these things. I won't get into some of the other issues on the budgets, the programmatic allocation versus the claims in terms of that are put out there, as well as the what do you call it, the cost of employment, etc. I think those are issues we are dealing with the CDA. I just think one more thing, perhaps, Chair, on the IMC. Look, we are working towards it. I think we have we have written, I need to just recall my memory. I do recall that there was a conversation. I know that even some discussions have ensued at a cabinet level around resuscitating the IMC. We did not stop the IMC. We thought it was important that the IMC continues with this work, and I think it will be a very useful tool to address and even hold other government departments accountable, because some of them would be part of this IMC. So I think, Chair, without really getting into some of the other details, let me leave it there. I know your bus is also very close to departure, but thank you very much for the presentation. We would love to come back at some point and give you some progress on some of the interventions that we've managed to deploy, including some of the conversations that we've had with the CDA and the meetings that we've convened with them and determined how to take some of these matters forward to address the scourge that is really crippling the Republic. So thank you very much, Chair. Let me leave it at that for now.
Thank you very much, Acting DG. We hope that you will come back again. This is not the first and the last time that you are presenting. The information is power. So we would love you to update us in everything that you are. Thanks ever so much to the Deputy Chairperson and the team of CDA. Thank you, everyone. Thanks, honorable members. Let's close the meeting. I know that there's a noise of the background, which I cannot assist anyone not to talk in the bus. Thanks ever so much. Let's adjourn the meeting. So the meeting has formally adjourned. Thanks.
Thank you, Chair.
Thanks.
Thank you, Chair.
Lindsay, you can close the meeting for all of us. Thank you.